professionals working on the front lines are risking their lives every day as they provide care during the COVID-19 pandemic. Jenna Cisneros spoke with a local nurse who shares the measures that they're taking to keep their own families safe.
These are just a handful of the faces working on the front lines during this pandemic.
I love being a nurse. I love caring for people. It's always been a passion.
CJ Adams is a nurse manager in the ICU at Bethesda North Hospital. She's also over the COVID unit.
So all of the patients that are located right outside of my door are all positive and or pending patients. So with that, I'm right in the middle of it, even if I'm not performing direct patient care like my nurses are. But the other unique side of that situation is my wife is also a nurse whose primary home is also on a COVID unit.
Her wife also pregnant with twins, and they have a toddler at home.
So for us, making sure we're taking all the precautions possible to make sure that we don't bring this home is of the utmost importance for us.
Along with wearing the protective gear at work,
we also will put our phones and keys and badges into a machine that will sterilize it for 120 seconds prior to coming home, just to make sure I've gotten any other bugs that could be hanging around cleaned off. Once I come home, I will Lysol again my shoes as well as my badge, and I leave that in the garage. Once I get into my walkway, I actually strip down at that point and put everything in the washer.
That wash is on a special sterilized cycle. She says the whole process takes her about 30 to 45 minutes. Her colleagues are doing the same.
So I know several of my team members and friends have either self-isolated in their homes or sent their loved ones to live somewhere else. So that's also a discussion we've had in our house.
It's just one of the many sacrifices medical professionals everywhere are making to not only save lives, but their own families too. Jenna Cisneros, Local 12 News.
CJ says if she had to ask the community for anything in return, it would be stay at home and continue practicing social distancing. I can't